I'm excited today to have Dr. Rachel Kim. Let me first introduce myself. I'm Chris Faulkner, and I run an agency in Greensboro, North Carolina, and my team went through Match. And my other role with Match is I am chair of the North Carolina Steering Committee. And I wanted to do this video to do some promotion and what's happening with Match in North Carolina. So Dr. Rachel Kim is the Director of Implementation and Associate Director of Training at Judge Baker Children's Center. So tell me and our audience a little bit about yourself and what you do at Judge Baker.
Sure. So I am a clinical psychologist by training, did a lot of my training more specifically in working with kids and adolescents, very relevant to our conversation today. I did my graduate training out in California at UCLA, actually working with Dr. Bruce Torpedo, one of the developers of Match. So really got immersed in the world of evidence-based practices, treatments like Match from a really kind of early stage of my training. And I was especially really excited about it because of, this idea of, well, in medical care, you get an evidence-based practice when you go to the doctors. You have a health problem, the doctors are doing the best practice, but then for some reason in a therapy room, therapists may not be. And so getting to learn from that early stage in my graduate career, how to actually make it work and make it happen so that kids are getting the best possible care in therapy as much as they're getting at a pediatrician's office or in a hospital. And so once I finished my graduate training, I came to Judge Baker Children's Center up in Boston, Massachusetts. We are a nonprofit children's mental health organization, and we do a lot of different things. We have our own therapy clinics. We have a therapeutic school for kids who have some more intensive emotional and behavioral needs. And then we also have programs like our quality care initiative, which the mission is to not only make sure that clients, families are getting good care from us directly, but then we're helping spread quality care out more broadly in the community. And so it's within that program that we were able to start to partner with folks down in North Carolina, like Chris, to bring some really great treatments into the community.
So tell me how you guys ended up in a little bit of the history of being in North Carolina and how many cohorts you've done and who's getting trained in North Carolina.
Yeah, so the conversations around bringing evidence-based practices to, or research-proven practices to the state of North Carolina have been happening for quite a while. I would say at least a decade, if not more. And I know a big part of that was folks who worked at the Center for Child and Family Health and the Child Treatment Project out of Duke and UNC. And so there really was this big push to bring higher quality care to the community. And so our CEO, Dr. Bob Franks, had begun having some conversations with the Department of Health and Human Services, early, probably around 2015, 2016, just saying, hey, we have something we think can help. Talking about our Match program. And so from there, we actually were able to start our first round of training in 2019. We trained 40 therapists at 6 agencies in partnership with Alliance Health, one of the managed care organizations in the Raleigh-Durham, Fayetteville area. Mm-hmm. And then, it went really well. And so the state wanted us to do a second round, which we started in 2020 and trained another 28 therapists from 6 more agencies in partnership with Cardinal Innovations, and are at this point kind of at the tail end of that process and wrapping up that work. And, even beyond just us coming in to train, a big emphasis of what we do is, how do we make it last? How do we make it stick? And so, like I said, we're at the tail end of that process, being that we're training and supporting local agency-based match trainers and supervisors so that they can keep that momentum going, training even more therapists to get more of this good care out into the community.
Okay. And I have something to add to that.
Sure.
I think it's a segue into what are the benefits of Match in North Carolina. And I know for my agency, I was part of cohort 2, and the benefits for Family Solutions is what you just referenced, was that leadership development. So I have 3 therapists that went through Match and chose to do supervisor training, and they just finished their first cohort internal to my agency. So what I like about that is it provides some agency self-sufficiency. So we're able to do some of the training ourselves at our agency. And surprisingly, these folks, they've really surprised themselves, and they've been excited about training. And, now they're starting to develop some leadership roles within my agency, which has been awesome to see them grow in that way. So what are some of the other benefits of Match coming to North Carolina?
I think that to start, it's helpful to think about what is Match in general, right? And so basically, Match, or the modular approach to therapy for children, is a therapy that's designed to help kids who are between the ages of 6 and 17, so kind of that really broad age range, who are struggling with anxiety, depression, traumatic stress, and even some kind of behavioral problems, right? And so in reality, we know that a lot of kids don't just have one of those challenges. They usually have some combination. And so what Match is pretty much a toolbox plus almost like a GPS system to help therapists know how to handle what's coming up for each kid, and then being able to tailor that treatment to each unique child. And so if you take into account the fact that if you're thinking about kids who are struggling with those different, that umbrella of challenges, that's about 70 to 80% of the kids who are coming into your local community mental health centers. And as a therapy, that means Match can cover and treat all of those different kids. And so if I'm thinking as a parent, I'm saying, great, this mental health center, this therapist has a tool to help me and my child. If I'm thinking as a therapist, I'm thinking, great, I have something to use with this family, and I don't have to learn 12 other treatments or different treatment packages to then add to that, because already as a therapist, my time is pretty tight. And I want to get good care to just about everyone I can. And I think even beyond that, Match has so many other like foundational therapy skills built into it. Like, how do you actually figure out what is the biggest problem that you need to address? How do you make a plan for treatment overall? How do you make a plan for a session? How do you even make sure that the kid is getting better? And so that's really helping, like what Chris was saying about his supervisors, is we're helping develop the workforce so that they're having a better foundation of skills and being better able to help that big range of kids and families who are coming into those local mental health centers.
Okay, so I know it's a modular approach, and if if I have a 12-year-old boy that comes in for services, mom or dad says, hey, anxiety is really high, I start treating the anxiety. Are there some assessments or something that would show, like, all of a sudden I realized there's a trauma history? And so they came in with anxiety, and I was really focusing on that. And then all of a sudden this trauma sort of landed in my lap. Am I just going to refer out for trauma, or just kind of figure it out? Or what does Match have to say about that?
Right. So there are a couple of components that do help address exactly that. So first of all, like I said, Match has a blueprint. So if you know that someone has anxiety, like this little boy, if you find out that he has a trauma history, it tells you, all right, here are some of the skills to treat the trauma that you can use. So those skills are already right there and recommended to you. On top of that, we're thinking about how do you actually find out that there's something else coming up. So as part of the MATCH treatment, we have what we call our treatment response assessment for children. It's a web-based tool where every week a survey link gets sent out to the family, the kid, and a caregiver. And some of the questions on that survey are really standardized things that cover a whole range of challenges that we often see in kids. And then the other part of that is a list of challenges that the family themselves come up with in their own words of what they're actually struggling with. We call that the top problems. And so every week, as a therapist, I'm seeing this data come in. I get these pretty little graphs that tell me how it's going. And then if I'm noticing, hey, it looks like, anxiety is getting better, but then I'm starting to see kind of more symptoms related to trauma and seeing a spike in that graph, that is then telling me, okay, now I need to go back to my roadmap, my blueprint, and pick the practices or the skills that are related to treating that trauma.
Okay. I know funders like to hear about data. And so it sounds like with TRACK, there's lots and lots of data that the clients participate in, and you have that data to show results or lack of results or where to focus your attention, sounds like.
Absolutely. I myself am a data nerd. I love it because I feel like it gives us such a rich picture of what is happening. And on top of that, I think that we do need to think about what is the family telling us, not just the data itself. So as a therapist, I'm also thinking about, in my session, what am I seeing? When I do a check-in with a family, right when we get started with each therapy session, what are they telling me they're struggling with? And so, we could say, yes, fully just rely on that survey data. But in essence, as a therapist, I'm pulling in lots of different information that actually makes the treatment itself much richer and more tailored even to the family itself. And so I know a lot of funders love the hard data. They love those numbers, but also they love the stories, right? They love the context to make sense of those numbers. And so as a clinician, I get to do both of those things.
Okay. Tell me a little bit about how MATCH has done through a learning collaborative, how it's taught and what that platform looks like, and a little bit about what a learning collaborative is.
So I like to think of a learning collaborative, basically, it's a vehicle that we use to get MATCH out into the community. It's basically a lot of different tools and activities that bring people from multiple roles within an agency and then across several agencies together so that they're learning together, brainstorming, and problem solving together. And a big part of that learning collaborative is helping agencies make MATCH work in their specific agency within their specific community. So kind of an analogy that I use sometimes to describe this is I think of the idea of MATCH in a learning collaborative being like getting pizza delivered at home. And so MATCH is that awesome, tasty pizza. It's been customized with the specific toppings and the specific kind of crust that a family wants, right? It's unique to them and their preferences and what they need, right? The learning collaborative then is like the vehicle or the delivery service that's trying to get that pizza to the family. Okay. Now, usually when a delivery driver gets in their car, they're thinking, okay, here's the map, here's the route that I'm taking to get this pizza to the family. But as we know, there can be road work, there can be an accident along the way. So the strategies within the learning collaborative are almost like a GPS system, that Google Maps on their phone that's telling them, let's find a different route around it so we're still getting towards our destination in an efficient way. So in the end, the family's happy because they got their tasty pizza while it was still hot. The delivery driver is happy because they got a good tip for the speediness of the delivery. And the family's going to then tell other families about this awesome pizza place and then help increase the business for the restaurant. Right? And so you basically have a bunch of happy families with lots of really great pizza, exactly to their tastes, piping hot when they want it, and delivery drivers who are making good money, restaurants who are healthy and flourishing, and then supporting the community as well. So really, the Learning Collaborative just is kind of that whole model of like, how do we make the process of getting matched to you the most efficient, effective that we can?
Okay. One thing I heard about the Learning Collaborative from my staff was practice. It sounds like there's a lot of practicing of the skills through role plays. So tell me why that's used.
Absolutely. So I think many of us at some point in our lives in school, we've sat in on lectures, right? In class, in college, even trainings as professionals. You sit in a lecture, maybe some of that sinks in. And, you know, the general expectation in like college is to memorize and regurgitate the information.
Don't
and then
fall asleep.
Yeah, don't fall asleep. Just memorize what you need to for the test.
Mm-hmm.
The thing with therapy, though, is it's not just a one and done. It's not just you do it once, you regurgitate the information once, and the test is over. You have to keep doing it. So you have to figure out ways to actually remember everything that you're learning at a really deep level. And a lot of people say that actually the best way I learn stuff is by doing it and practicing it. So we start that right in the training itself by having therapists role play the skills with each other. Maybe they're pretending to be the kinds of clients that they most typically see. So it feels like a real experience. And then we add on to that a series of what we call clinical consultation, where it's a group of therapists coming together with one of our match consultants, our match experts, and then talking through their actual cases and thinking about, in the real world, how am I actually using the skills and like making sense of the case? And so having that support is what helps the therapist learn the skills even deeper and learn not just what to do and how to do it, but how to think about the process as a whole. Right? I like to say in Match, we're not just teaching people how to do a single skill like problem solving. Mm-hmm. We're teaching people how to think about a case and problem solve around a case. And that's why the supervision, the practice, the role play all come into place so that they can get that practice and that kind of bigger picture learning.
I know from my agency, from an agency perspective, that was so helpful, is the supervision and the support. It wasn't like, hey, team, go to 5 days of training, listen to Rachel and Dan, and then come back and cross your fingers and hope that you can practice those skills or find some clients. Because I know the expectation is the therapist actually have a caseload, have clients, enroll them in Match, enroll them in Track, and go ahead and start practicing those skills, and then problem solve and figure it out with your internal team and with the Judge Baker team.
Absolutely. We really believe in that practice-based learning, and also about like building a community of support. Therapy is really draining work, and having a support system in the form of colleagues and coworkers, supervisors at your agency, colleagues at other agencies, even who may do things a little bit differently or serve a slightly different population, and then having, I mean, I guess I'm an expert. So, having an expert who's then giving you some other support and guidance is really just such a nicer way to learn, and just makes the experience feel less isolated.
Okay. I have a great story. One of my therapists, and I'm not sure if you know this story or not, but one of my therapists, part of her practicing the skills was to actually practice one of the anxiety activities herself. And she's in her mid-20s and did not know how to ride a bike. And so she really wanted to ride a bike, and to practice the anxiety modules. She told in a training that when she was about 8 or 9, she tried to learn how to ride a bike. And then about 5-6 years ago, she was in her early 20s and tried to learn how to ride a bike again, and actually ran into a car and had an accident. So she had a couple of reinforcing events that made this very anxiety provoking and fearful, that like, I don't know how to ride a bike. And she actually went through some of the steps and some of the worksheets to learn how to do that. Have you heard that story? Did you know that?
That therapist did share that story with us while we were in consultation, and I loved it because that's what we call living the exposure lifestyle. That's one of our catchphrases, right? It's so for anxiety, the best way to get over anxiety is to gradually face the fears. And so that you're relearning that maybe it's not as bad as I thought, or I can handle it. And those are really empowering messages. And so for a therapist to actually do that and live that out, I can't imagine how many of her own clients she can then say, I'm having you do exposure for your hard thing. I did it too.
Right.
I'm not gonna tell you to do anything that I'm not willing to do. So, that's much more inspiring and motivating to a client than just saying, you go do that hard thing. I don't have to do the hard things myself, but you can.
You can. Yeah, you go ahead and do that, right?
Yeah, we got to practice what we preach. And I think that story really illustrates how she's done that. And she shared several other examples over our time together of different small ways that she's faced her fears. And that's amazing, because I think that, not only are we helping her grow as a clinician, she's growing personally too.
Right.
So I love hearing those kinds of stories.
Yep. Tons and tons of empathy to be able to do that. And well, let's see, I'd like to wrap this up. And so I'd like to comment on a few things. So if folks are interested in learning more about Match, North Carolina has created a Match website, and that's www.matchnc.com. I will have that in the video notes when we upload this to the website, so folks can access that. And if folks want to know more about Judge Baker, how can they hear about you or find out more about Match online or about Judge Baker?
Absolutely. So you can always visit our website. It is jbcc.harvard.edu. So we have lots of different information there about our direct service programs, about the quality care initiative through which we're doing these Match learning collaboratives, and just different kinds of little tidbits and information. And then also, if you want to speak with any of us personally, you're always welcome to email us at training@jbcc.harvard.edu. We're generally really good if people are interested in learning more, if you want training yourself, or just finding out what some options are for that, we're happy to talk to you. And on a broader level, the state of North Carolina specifically has already invested in, doing the second round that we're wrapping up now. And we're, I think, just about ready to start a third round of the Learning Collaborative as well. So as usual, it takes some time, but if you're interested in participating or just finding out more information about it, please send us an email. We're happy to chat and add you to our email list. so that you're aware when some of these other parts get going.
All right. Sounds great. Thank you so much for taking the time to do the interview today. And we'll get this posted and let folks learn lots and lots of information about Match. Thanks.
Awesome. Thanks,
Bye-bye.
Chris. Great talking to you.
Bye-bye.